Every single morning you do something without realizing it. You look in the mirror, you see it, that fullness under your chin, and somewhere in the back of your mind a voice plays the same recording it's been playing for years. It's genetics. My mother had it, my grandmother had it. That's just how we are. And with that one sentence, you close the case. You move on with your day. Here's the problem. That explanation isn't completely wrong. There is a genetic component. But that genetic component, it accounts for roughly 10% of what you're actually seeing. The other 90% has specific names, specific biological mechanisms, and specific interventions that produce real visible changes when they're applied correctly. Stay with me for the next few minutes, because by the end of this video, you're going to understand your own face in a way that no doctor, no trainer, and no skincare brand ever bothered to explain to you. I'm going to give you a complete protocol, 4 specific exercises that targets the exact muscles responsible for this. But before we get there, I need you to understand the why. Because without the why, the protocol is just instructions without a map. Let's build the map first. The area under your chin, what medicine calls the submental region, isn't just fat. Most people think it's only fat. It's not. Underneath that layer of fat is a complete muscular architecture, a system of muscles that, when they're working properly, hold everything in place, like a hammock that supports all the soft tissue in that region. When that hammock has good tone and strength, it keeps the fat contained, the skin taut, and the jawline defined. When that hammock weakens, when those muscles atrophy, everything that was being supported drops. The fat that was contained becomes more visible. The skin that was held taut relaxes. And what you see in the mirror is what you've been calling genetics, when in reality, it's a muscular support system that nobody ever told you needed training. Now, 3 muscles matter most in this story. The first is the platysma. This is a thin, flat sheet of muscle that covers the entire front of your neck, from your collarbone all the way up to your chin. It's one of the most unique muscles in the human body because its fibers insert directly into the skin of your neck. That means when it has good tone, it keeps your neck skin tight and your jawline defined. When it atrophies, and it does atrophy progressively after 50 for reasons I'll explain in a moment, the skin loses that support and falls. That's what people call the turkey neck. The second is the mylohyoid. Along with the geniohyoid and digastric muscles, it forms the floor of your mouth, and it acts as the deep foundation of the submental region. Think of it as the base layer of that hammock. When these muscles are strong, even moderate fat in the region stays supported and less visible. When they're weak, even a modest amount of fat drops forward and becomes prominent because there's nothing holding it from below. The third is the digastric. It has 2 muscle bellies connected by a tendon, and it plays a key role in defining the cervicomenial angle, that crisp line between your jaw and your neck. When it's well toned, that angle is sharp. When it weakens, the line blurs and the jaw and neck start to look like one continuous surface. That's the visual signature of an advanced double chin. Here's what's critical to understand about all 3 of these muscles. They are skeletal muscles. They are voluntary. They can be trained, exactly the way you train a bicep or a quadricep. The reason most people never train them isn't that exercise doesn't work. It's that nobody tells you this zone exists as a training zone. Every workout program in the world covers nearly every muscle group in the body. But the submental musculature? It's the one region that's systematically left out of conventional training. And that omission has visible consequences that millions of people have been misattributing to genetics for decades. Now I want to talk about something that most fitness videos never bring up, and it's the reason this problem often gets dramatically worse after 50, even in people whose weight hasn't really changed. It's hormonal, and it works in 3 layers. In women, estrogen levels drop significantly during and after menopause. In men, testosterone gradually declines through their 50s and 60s. Both hormones have direct effects on muscle protein synthesis throughout the body, including those submental muscles we just talked about. When these hormones fall, the rate at which your body builds and repairs muscle slows down. Protein breakdown increases proportionally. The result is a progressive loss of muscle mass that physiologists call sarcopenia. It affects every muscle in your body, and yes, that includes the platysma and the suprahyoids. The hammock gets looser, and the tissue it was holding drops. Layer 2, cortisol. This is the stress hormone, and in people over 50 who have carried chronic stress for years, work, family, financial pressure, health concerns, cortisol tends to run chronically elevated. Here's what's important. Chronically elevated cortisol produces a very specific fat redistribution pattern that every endocrinologist recognizes. It favors fat deposits in the trunk and, critically, in the cervical region, including directly under the chin. At the same time, it accelerates muscle loss in the extremities and postural muscles. That combination, more fat in the neck, less muscle support, is exactly the recipe for a double chin that worsens during periods of high stress without any real change in your overall weight. The fat didn't appear from nowhere. It was redistributed. Cortisol told it exactly where to go. Layer 3, insulin. Chronic hyperinsulinism, the kind that accompanies insulin resistance, which is extremely common after 50, has direct fat-storing effects. Insulin stimulates fat cells to accumulate more lipids, and the fat deposits in the submental region have an unusually high density of insulin receptors, making them especially responsive to that fat-storing signal. This is why people with insulin resistance often have a double chin that's disproportionately large relative to their overall body weight. And it's why improving insulin sensitivity through lifestyle changes, before any exercise protocol, produces a visible reduction in that region that goes beyond what general weight loss alone would explain. There's a third factor driving this, and it's one that nobody talks about. It's not hormonal, it's not muscular, it's postural. And for people who spend hours in front of screens, it may actually be the biggest daily driver of the problem. When your head is in proper alignment, balanced over your spine, chin slightly retracted, the suprahyoid muscles are at their optimal resting length. They maintain their baseline tone naturally. Now think about how most people sit when they're working at a computer, or driving for long hours, or scrolling their phone with their chin pointed down. The head shifts forward, sometimes by several centimeters. A muscle that's chronically held in a stretched position gradually loses its ability to generate tension. It weakens. And in the case of your suprahyoids, that weakness means less support for the tissue beneath your chin. Simultaneously, and this part matters, that forward head position mechanically compresses the soft tissue of the submental region. It makes whatever is there look more prominent, regardless of actual volume. Here's the remarkable part. People who correct their cervical posture consistently over several weeks frequently report that the submental region looks different before any change in fat has occurred, simply because the tissue is no longer being compressed forward. Posture isn't cosmetic, it's structural, and it's modifiable. Before I give you the exercises, I want to say something clearly because this is where most people go wrong. The typical double chin exercises you'll find online, moving your head up and down, turning side to side, those work the sternocleidomastoid and the upper trapezius. They have almost no meaningful impact on the submental contour. The muscles that actually matter, the platysma and the suprahyoids, require completely different exercises most people have never done. Here's the protocol. Exercise 1, the low cervical contraction. Sit up straight, shoulders relaxed. Pull your lower lip downward and outward in an exaggerated grimace, like you're expressing extreme disgust, enough to expose your lower teeth. If you place your fingers on the front of your neck, you'll feel the bands of the platysma tighten under your skin. Hold that contraction for 10 seconds. Rest for 5. Repeat 15 times. The signal that the stimulus was sufficient, a feeling of mild fatigue or warmth in the front of your neck by the end of the set. Exercise 2. The tongue to palate press. Sit up straight. Close your mouth, teeth lightly touching. Place the tip of your tongue against the hard palate, the roof of your mouth just behind your upper front teeth, and press upward with maximum force. Place your fingers beneath your jaw in the submental area while you do this. You'll feel the tissue firm up. That hardening is your mylohyoid and geniohyoid contracting, the exact muscles forming the floor of your mouth and the base of the submental region. Hold for 10 seconds. Rest 5. Repeat 15 times. This exercise comes directly from orofacial rehabilitation protocols that speech-language pathologists use for oral floor strengthening. It's the most overlooked exercise in the entire double chin space, and arguably the most important because it directly trains the structural base that supports everything visible from the outside. Exercise 3. The turtle. Sit up straight. Push your chin forward as far as possible, like you're trying to make your jaw protrude out of your face. Hold 2 seconds. Then pull your chin backward with equal exaggeration, retracting it as far as possible toward your cervical spine. In that maximum retraction, the platysma, the suprahyoids, and the deep cervical flexors all contract simultaneously. Hold the retraction for 5 seconds. Return to neutral. Repeat 10 cycles. The full set takes under 2 minutes and produces a fatigue response in the submental region that signals sufficient training stimulus. Exercise 4. Resistance compression. Place the tennis ball between your chin and your upper chest at the submental point and compress it by pushing your chin firmly downward for 10 seconds. This creates isometric resistance for the suprahyoids and platysma, and that resistance is key. To produce meaningful muscle hypertrophy, a muscle needs to work against a load. The tennis ball provides that load in the only region of the body where conventional equipment never reaches. 10 repetitions of 10 seconds with 5-second rest between each. Frequency and timeline. Do these 4 exercises 5 days per week, not 7. Muscles need recovery time to adapt. The full sequence takes 8 to 10 minutes. Realistic timeline for visible change, 6 to 12 weeks of consistency. The submental musculature has a slower remodeling rate than the muscles of your limbs, but when the response comes, it's lasting, because it's built on real muscular adaptation, not a temporary trick. I owe you honesty about what doesn't work. Topical creams, caffeine serums, retinol, vitamin C, they don't penetrate to the fat tissue beneath your skin in concentrations sufficient to produce actual fat reduction. They can improve skin texture and hydration. They don't change what's underneath. Massage devices and vibration tools, they produce temporary local vasodilation, some temporary skin tone improvement. They don't reduce fat. Radio frequency and focused ultrasound, these have real evidence for improving skin quality and collagen stimulation. Their effect on fat volume is limited, and the cost is significant. If, after 3 to 6 months of this full protocol, you want a medical intervention for residual fat, deoxycholic acid injection, a compound that destroys submental fat cells on contact, is the one option with genuine clinical evidence for this specific indication. That conversation belongs with a qualified physician, not a YouTube video. But the protocol comes first, always, because it addresses the actual causes at a cost of 8 minutes and a tennis ball. I want to tell you about a patient I'll call Don Rodrigo, 61 years old, engineer, 7 to 9 hours a day in front of screens, head consistently forward. His double chin had worsened significantly over 3 years, coinciding directly with a period of extreme professional stress. His weight hadn't changed. He'd been going to the gym regularly throughout that time. He'd never once worked his submental muscles because no one had ever told him that zone existed as a training zone. When we evaluated him, head was displaced forward by approximately 4 centimeters from the vertical axis of his spine. Morning cortisol at the 82nd percentile for his age and sex, consistent with chronic stress. Zero specific muscular work in the region. We implemented the 4-exercise protocol 5 days per week. Postural correction with cervical retractions 3 times daily. Screen raised to eye level at his workstation. And a basic sleep hygiene protocol. Consistent bedtime. No screens in the hour before sleep. At 4 months, the change was documented in photographs. No surgery, no procedure. Muscle trained, posture corrected, cortisol lowered through sleep. He told me something I haven't forgotten. For 3 years, I accepted something as inevitable genetics that turned out to have 3 identifiable causes and 3 specific solutions. If someone had explained this to me 3 years earlier, I would have started 3 years earlier. That's exactly why this channel exists. Let me leave you with a clear summary of what you now know. Your double chin, in 90% of cases, is not a genetic fate. It is information. It's telling you that your submental musculature hasn't been trained, that your cortisol may be chronically elevated, that your posture may be compressing that tissue every day, and that your hormonal environment may be actively directing fat toward that region. Every one of those factors has a specific, actionable intervention. This week, start with 3 things. 1. Begin the 4-exercise protocol. 8 to 10 minutes, 5 days a week. 2. If you work at a screen, raise it to eye level today. That single postural change starts working immediately. 3. Prioritize your sleep, not as a luxury, as a direct hormonal intervention that lowers cortisol, the hormone most responsible for directing fat toward your neck. If this video gave you something concrete, if you now understand what the platysma and suprahyoids are, why cortisol sends fat to your neck, and what you're going to do about it, please hit the like button. Not for me, because the YouTube algorithm will show this to more people who've been looking in the mirror for years, resigning themselves to something that in most cases has identifiable causes and real solutions. And subscribe if you haven't already, because in the next video I'm going to explain why the skin of your neck ages faster than the skin of your face, and what you can specifically do to slow that process. Not creams, mechanisms. You won't want to miss it. Your double chin is not your genetic destiny. It's information, and now you know exactly what to do with it.